Well, headaches caused by another illness or physical issue have a special name and treatment all their own. Here to tell us more about that is Dr. Richard Busch of Busch Chiropractic. First of all, doctor, always good to see you.
Always good to be here.
What is the medical term for these conditions?
Well, the medical term is a cervicogenic headache, which is about a $5 word that just basically means a headache that starts in your neck. In a lot of cases, these are as a result of things like auto accidents where a whiplash type of an injury or a fall. In some cases, they may be as a result of very infrequently things like an infection, but more often than not, things like elevated blood pressure. Stress can also be involved with this. Disc-related problems like we treat with the DRS program, that type of thing, those are all different causes of these types of problems, and they may manifest or they may show up in a lot of different ways. You may notice that it's just the tightness that you feel from your neck into the upper part of your shoulders, into the skull or the base of your head, on either side, but generally speaking, they're one-sided for headaches like that, or right at the base of your skull. But then along with that, you may notice numbness or tingling or even discomfort that radiates down into one of your arms, and then along with that, a lot of stiffness, that just decreased range of motion that we see. And a lot of times people will even wake up with these types of headaches where they say, it seems like I just slept wrong and I woke up with a crick in my neck.
So obviously, I mean, any type of a headache is, well, I don't want to say a pain in the neck, but
Right.
it's like, it'll drive you crazy. But when it's not even a typical headache, it's like, what's the sign that, you know what, I better see something about this?
Well, first of all, obviously, especially if you have elevated blood pressure, that can be another thing that causes these types of things. So we want to make sure blood pressure is actually kept under control. But then along with that, when it starts to affect what you're able to do, I mean, some of the things that we can do to help avoid these is, when you do get that stiffness or that crick in your neck, you can just use some ice at the base of your neck or your skull, or right at the base of your head. That will actually help with it in a lot of cases. I would stay away from heat, because a lot of times heat will actually, it feels good when you're doing it, but it gets worse afterwards.
Right.
And then along with that, some of the other things are things like just regular chiropractic care, where we're actually gently manipulating those bones in the spine. That'll help, number one, restore normal movement, but number two, take some of the pressure off the nerves, and then kind of regulate some of the blood pressure, the circulation back to the brain.
I know this is something that's been going on for a while, and you want to identify what is causing that.
Certainly you do, and that's one of the reasons that when we're evaluating patients for these types of problems, we do a good history. We want to make sure we know exactly where the thing started, because if you do a good history, you've got about 80% of the answer right there. And then from there, a good physical exam, and so that physical exam deals with range of motion and some of the neurologic and orthopedic testing. We also screen for strokes at that point in time. We want to make sure that that's not something else that's going along with it. Something that we see an awful lot of, if you ever have the worst headache you've ever had in your life, it's generally an indication we need to start looking at a stroke. Not something that we see a lot with the rest of these, but it's just something to keep an eye on. So those are things we need to go to the emergency room for. With all that being said, we want to do a good history, a good exam, and then in a lot of cases, a good set of films, whether they're x-rays or MRIs, depending on what's actually necessary at that point in time.
Yeah, definitely want to identify that. Don't want to live with that type.
No, we don't.
All right, doctor, we appreciate it.
Thanks, sir. I appreciate your time.
You can find out more about Busch Chiropractic. Just call the number right there on your screen or visit buschchiropractic.com.